Dear Chairman, dear audience, my name is Luca Hergár, and I would like to show you my 15 months progress on my PhD topic, Translational Keypoints between Radiology, Physical Examination, and Hand Surgery. I'm a resident doctor at the Department of Orthopedics at Semmelweis University, and my vision is adequate diagnosis at the first doctor-patient interaction, and my mission is to evaluate the accuracy of diagnostic methods in hand surgery. Currently working on 3 topics. The first one is about the diagnostic accuracy of magnetic resonance imaging for wrist ligamentous lesions, and the other 2 projects is about the 2-point discrimination and its diagnostic accuracy in hand surgery. My first project is the right conditions to make wrist MRI an accurate preoperative diagnostic tool for ligament injuries. It is important to know about the background of this project is that wrist soft tissue injuries are common pathologies, and now the gold standard diagnostic tool for these lesions is wrist arthroscopy. However, this is an invasive procedure with a complication rate between 1 and 8%. Before the wrist arthroscopy is advised to perform a wrist MRI as well, to help the preoperative diagnosis and the operative planning. But the diagnostic accuracy of wrist MRI is spread on a large scale based on our literature search. And this is why our aim was to determine the diagnostic accuracy of MRI for wrist cartilaginous and ligamentous lesions, and also to determine the factors that are affecting the diagnostic accuracy of MRI. We examined patients with suspected ligamentous and cartilaginous lesions of the wrist. The intervention was wrist MRI that we compared to arthroscopy. And our outcome was the diagnostic accuracy, the sensitivity of this method. Our hypothesis is that the diagnostic accuracy of MRI is close to arthroscopy, and there are certain factors that increase or decrease this diagnostic accuracy. Here you can see all our results. We found the overall sensitivity of MRI to be 76% and the specificity to be 87%. We found that the field strength of MRI has an important effect on the specificity. As higher field strengths are applied, we can count on higher specificity. The same for the application of fat saturation. We found it's mostly the specificity that increased with this technique. The application of wrist coil and 3D sequences had a positive effect on the sensitivity. We also found that based on the different anatomic locations of these injuries, the sensitivity and the specificity differs. So for the best sensitivity was achieved for the TFCC injuries, and especially when they distinguish the central and the peripheral tear of the triangular fibrocartilage cartilage complex injuries. For scapholunate and lunotriquetral ligamentous lesions, the sensitivity was lower, but the specificity was quite important. In conclusion, we can say that low-field MRI has a clinically low sensitivity and specificity, and we advise clinicians to ask for a minimum 1.5 Tesla field strength when they are performing wrist MRI examination. The application of 3D gradient and the use of wrist coils can increase the sensitivity of this examination, while the fat saturation and the application of higher field strengths can increase the specificity. We found that anatomic locations of these tears matters, and we should be aware that we get more accurate results in the case of TFCC ligamentous injuries, while for scapholunate and lunotriquetral tears, the physical examination might be just as important as the use of radiological imaging. The strength of our study is that we included a lot of studies, 38, and also that we focused on different kinds of injuries separately and together to define the accuracy of this, of the diagnostic accuracy of magnetic resonance imaging. However, we were limited by the heterogeneity of the studies and the different lesion classifications, sometimes also by poor data quality. In conclusion, we can see that magnetic resonance imaging is a reliable tool for the preoperative diagnosis for ligamentous lesions if the technical conditions are adequate. We have finished and submitted our article at the Clinical Orthopedics and Related Research magazine, and we are waiting for the response from the journal. My second project is the correlation between two-point discrimination and electronography in carpal tunnel syndrome. In carpal tunnel syndrome, the median nerve is under compression, causing motor and sensory loss of function. The gold standard diagnostic tool for this disease is electromyography and electroneurography. However, it's also important to assess the degree of severity of this disease during the physical examination to facilitate the preoperative planning. To examine the sensory function of the hand, we can use the two-point discrimination method, what you can see here on the picture. The two-point discrimination distance is the smallest distance that a patient can feel as two separate points on the side of the finger. Our aim was to define whether the two-point discrimination has a correlation with the electroneurography results. We examined the patients with carpal tunnel syndrome at the outpatient care of the Semmelweis University's orthopedic clinic. We performed the two-point discrimination measures and also sent the patients to the electroneurographic examination. The outcome was the degree of severity. Our hypothesis is that there is a correlation between these values that can be used in the everyday clinical practice. Here you can see our results. You can see that we found a positive significant correlation with the severity category of two-point discrimination values and the distal sensory latency, and also with the severity of the electroneurographic examination. This correlation was also present when we examined the two-point discrimination by millimeters. However, we found that this correlation is not very strong. There is a correlation, so we can count on this correlation when we plan the preoperative examination, but the two-point discrimination can be the only tool how we assess the severity. The electroneurographic examination has to be performed as well. Now there are some additional statistical analysis what is still ongoing with this project. But we also started to write the manuscript, and we plan to finish it at the end of this year. And we would like to submit it to the Injury magazine. My last project is about the investigation of the effects of different conditions on two-point discrimination values, as we suspect that in the general population, beside compression on the median nerve, there can be other factors that are influencing these values, such as the age, the gender, or the cortical function of these patients. And the aim of our meta-analysis is to find out what are these conditions and whether they increase or decrease the sensibility of the hand. With this project, we had to redo the systematic search as it was a long time ago, and now we finished the title and abstract selection, and we move on to the full text selection. So here you can see the overview of our three ongoing projects. The first one is already submitted, and we are working on the two other projects. We plan to finish and submit them soon. Thank you very much for your attention. And here you can see my quote from Antoine de Saint-Exupéry: "A goal without a plan is just a wish." Thank you very much.
Thank you very much, Luca. It was a wonderful presentation. My question is that according to your results, do you have any advice to the clinicians in everyday use?
Yes, we think that with our results, it would help the clinicians with the preoperative planning of patients who have wrist ligamentous injuries. We advise them to ask for an MRI, wrist MRI, with at least 1.5 Tesla field strength. And it's important that we know that if we would like to really have the accurate results, we should go for higher quality, that with a higher field strength, with the possible application of risk coils, because if we have an adequate diagnosis, then it's much easier to plan the intervention as well.
Luca, congratulations for this very nice work you presented. My question would be that in this two-point discrimination study, were there any inclusion criteria and exclusion criteria?
We included all the patients who came to the outpatient care at the orthopedic clinic at Semmelweis University and who were operated. So there is we are aware that there is a bit of a bias in this project, as all these patients were operated, and we don't have the ones that chose the conservative treatment. And the exclusion criteria was only the patients who were under 18 years old, as there was one or two patients, yes, who had extreme conditions, and this is why they developed the carpal tunnel syndrome. As we consider that this is not the typical patients population, they were not included into the study.
So, turn around my question. Are there any other diseases like diabetes, which could influence the result?
Yes, definitely. That this is why we planned the second meta-analysis as well, to find out that in the case of diabetic patients with the damage of the nerves, the two-point discrimination can be different from the normal population, even if they don't have carpal tunnel syndrome. So this is why, as we consider that this might be a useful method in the physical examination, but we have to look at the patient as a whole and to take into account all the other symptoms as well to establish the severity of the disease.
Thank you.
To this question, actually, I'm just wondering whether, of course, some of the patients will have diabetes, and because of that, it may happen that between some, let's call normal limits, the two-point discrimination will increase. But it's a very sensitive question. That when can you say that there is a disease of the nerve, and when can you say that there is a natural deterioration that is not a disease, but actually the nerve conduction is there, but maybe the nerve endings, that's something is changing.
Yes, it's a very important question, because carpal tunnel syndrome usually arrives at patients who have diabetes, because the carpal ligament is thickened with the different distribution of fluids, so it can touch the diabetic patients as well. And I would say that in this case, the two-point discrimination might not be as sensitive as for other patients. And in these cases, as we should evaluate the two-point discrimination for the follow-up, and to find out that after the carpal tunnel release, is there an improvement for these patients. But it shouldn't be considered as the first line, in the first line of the diagnostic measures.